What's up everyone? So today was my first day of the family med rotation, and I'm gonna go over it right now. The 7 types of patients that you will see on a family medicine rotation. Or maybe it's not just the only 7, but the 7 that I saw today. As you can tell, I'm already in different clothes. It's because I started this yesterday and I was too tired and I actually legit knocked out on my bed. Like, this is what I was wearing yesterday. It's really hard to try to make videos when you're in med school. Like, wow. You get exhausted from going to work every day. The first patient you're gonna see on family medicine is this guy who I like to call Mr. Motivating. This guy comes in having researched everything about their illness and will come and make you think that you're wrong. Sir, your lab results came back and you actually have a high creatinine. A high creatinine? I saw online that, a high creatinine means that I could have a 25% chance of a hypercholesterolemia and having a 6th toe growing out of my nose. Oh, well, actually, I haven't seen that piece of literature yet, but yes, there are some risks with having a high creatinine. High creatinine, my baseline was a 1.2 and now it's a 1.4. So they're really involved in their health, which is good because some patients aren't, but they're like over involved to the point where you're just sitting there. I guess you're gonna diagnose yourself and I'm the one who's gonna end up getting paid, which is fine. I'm cool with not doing work. That's cool too. You do you, bro. That's fine. So the second kind of patient you're gonna see is this guy who I like to call Mr. ED. I don't really want to explain what happened. I just want to show you what happened. This is me. This is the patient. Hi, Mr. ED. How can we help you today? I kind of, had a fever and, I was feeling kind of sick and I just want to, follow up with the doctor, I need a physical, and I also want to talk to the doctor about ED, just to get it out there, Following, like fever, I know what that is, physical exam, I know what that is, and ED, I was like, ED was the doctor, okay, well, here, let's consult the whiteboard. I don't even know if this is in frame. Number 1. ED could be emergency department. Electron density, and then 3. It hits me. He wants to talk about erectile dysfunction with the doctor. And I was like, oh, he feels embarrassed. Bro, we've seen it all. So ask. That's a good takeaway point from this video. Ask if you don't know. Or you could play it off like me and finally get it after 3 minutes. That's not good. The third kind of patient you're gonna see on the family medicine rotation is, I was not ready for this patient. I thank God that I walked in with the senior student who was there because they took reins of the show. The third kind of patient you will see on your family medicine rotation is a little someone I like to call Miss Menopause. Whoa. There should be a warning sign on the chart before you go into the room that says, alert, patient on menopause. Because you just need to get, mentally ready for this, roller coaster ride. Strap in full seatbelt and go. This is my third patient. I'm like, oh yeah, I love family medicine. It's so great. And I go in, and this is what I'm greeted with. Oh. No, I don't have time for this right now. I got Lyme disease and I don't have time for this. Just get me the doctor. Oh, okay, we'll go get the doctor. Just stay. All right, we're staying. Oh, I just hate it when they give me students. All right, we're going. Just check me or something. I think I'm Lyme disease. All right, we're checking. Thrown in and out of the room. I didn't move from my spot, but in my mind I was leaving and coming back because she was angry that we were there, but wanted us to stay, and then was crying. We gave her tissues, and then she was like, thank you so much, I'm sorry, I've just been so mean to you guys about my menopause. Once she said menopause, clear. I understand now. Not that it's attributed to menopause, but it's attributed to menopause. The fourth kind of patient you're gonna see is one of the highlights of my 2 days so far on family medicine. The kid. Peds case that comes in, you're just finally not an adult. They give you one-word answers because they're not sure if they can trust you, because you're trying to be really friendly and they just met you, and so they look to their mom every question you ask, and you're like, so have you been feeling sick recently? No. When they mess something up, the mom corrects them. They're like, no, mom, don't do that. So this little kid comes in, wants a paper to be cleared to go to like band camp. Like, oh, so you like to sing and stuff? And, yeah, trying to like show off that he's cool. You know, doesn't really need to answer all my questions. I know the game you're playing, bro. I played it. I invented this game. What's your favorite song? I don't know. Oh, so you want to sing for me right now? No. All right, little booger. And then the best part that made me laugh so much when the doctor was laughing too and his mom was laughing too. The doctor comes in to do the GU exam. For those of you who don't know, it means genitourinary, which is like the genital area, which is like the PPs and the BVs going down here. The doctor comes in and she puts on the glove and then she's like, can you just stand for me? And she opens his pants and she's reaching inside. He's like, and I laughed so hard. And he's like, oh, it tickles, it tickles. Certain cases that like stress you out, and then you end up with these really funny cases that just remind you of like the simplicity of life as a child and how we can all grasp it. Wow, I'm so poetic! The fifth kind of patient you will see is a little headache I like to call Mr. Stubborn. Lord have mercy. I hope you never actually have to interact with this kind of person, because the audacity, it blew my mind that someone, and okay, let's do it. Oh, is everything okay? It's fine, it's fine. Well, no, it's fine, just, whatever, just stay, whatever, doesn't matter. Okay, well, how can we help you today? I have a bad cough. He's coughing the entire time, so clearly there's a problem with the cough. Can't you hear it? Let's go through all the questions. So I'm asking all the questions. Mr. Stubborn is the kind of patient who questions your questions with their own questions about your questions, and that just like lengthens the stay of time that they have to be in the room. If they're in a rush, they might as well answer the questions, but no, you know, I have to show you that I'm dominating over you or whatever, and I'm a man. My final question was, has this impacted your social life in any way? Come on, how is that important? I'm the captain, you know, I ask the questions here. But whatever, I was being kind, I was being nice, because that's how my mama raised me and my dad. Happy Father's Day. Let's say that you took off from work, it would be important for us to know that in case in the future you need like a letter for work or something, we would have it documented, and then we could be able to write you the letter. I work for myself. Why was that so hard? You could have skipped that whole thing and we could have been doing the physical exam. I could have been out of the room by now. But no, Mr. Stubborn, you gotta show that you got a personality that's type annoying. Okay, I'm just gonna start the physical exam now. I'm gonna need to listen to your heart and lungs. So I put my stethoscope on. This is what happened. And the cord for the stethoscope is not exactly a super long cord. You are the patient sitting at your computer screen, and I'm me, and I'm just listening. And he has a chronic cough, yes? Well, homie bro, as I'm stethoscoping around, coughs in my face twice, and doesn't even have the self-decency to just turn his head one way or the other. He just coughs into my face. In shock, first of all. I'm in shock. I didn't wipe it or anything because I'm a kind person. I just acted like it didn't happen. So he coughs in my face, and then it's all like, oh, I'm sorry. And I was like, no need to apologize. Except, that didn't happen. I made up that last part. That was acting. He never even apologized. He just coughed into my face and didn't say anything as if it was normal. Mr. Stubborn is kind of like Miss Menopause, except they're mean, but don't apologize for it. Miss Menopause is like hormonally, you know, it goes up and down. Mr. Menopause, he probably is Mr. Menopause. Mr. Stubborn is always riding on that mean curve because that's just who they are. So the sixth and final patient that I'm going to be talking about, I thought I had 7, but I guess it's just 6, is Miss Lunch Break. And this was the final patient that I interacted with on my first day of family medicine. Our site is set up is I just walk through the hallway, and if there's a form on any of the doors, that means that there's a patient inside, and so I just take the form off, review their charts and everything, and then I go inside. This particular patient's room door was open, and no one was inside with her. So I go and I ask, has anyone seen you yet? No. Yeah, a lot of sass actually from this day of patience. Give me 2 minutes and I'll be right in with you. Okay, so I'm on my lunch break. Can you and the doctor both come in at the same time? Because I don't want to be repeating myself. Okay, that's fair, that's fine. Check the chart and everything, and I'm waiting for the doctor to come out, you know, because the doctor is seeing another patient. 1 minute, 2 minutes, 5 minutes, and we're still waiting for the doctor to come out, and she said she had to go back to work and her lunch break ends in 15 minutes, and I told her, okay, so my word is on the line, but the doctor's not coming out, so I'm like freaking out because I don't want anyone to yell at me and be like, he's the kid who told me. So I come up with this idea, I'm like, okay, I'm going to let the patient decide what's going to happen, you know, inform them, be clear, open communication, be transparent. I know you requested that both myself and the doctor come in at the same time so that you don't repeat yourself. I wanted to let you know the doctor is still seeing a patient and I don't know when she'll be out, so we have two options right now. We can wait until the doctor comes out, which, I don't know, might go past your lunch break, or I can ask you the questions now. How will this make it faster? I will ask you the questions and then the doctor will go straight to the problem. Alright, let's do it. So, how can we help you? And she's like, I'm a mess. I'm a mess. And I was like, well, I should have waited for the doctor. But I keep going. I was like, okay, so can you tell me a little bit more about what's going on? Everything. But everything is a problem. She starts off not wanting to answer my questions. I have charm. And by the end, she was like talking endlessly. And I got so much information. Then I get out and I finish. And I'm like, okay, I'm going to go present this to the doctor. We'll be right in. She's like, well, I'm almost going to lunch. I was like, I know. Oh, I can't control the doctor. The doctor comes out, and then she's about to just dart into the woman's room. I was like, no, please don't do that, because you're gonna ask her all the questions that I already asked, and she's gonna crucify me. So I like go. I didn't grab her, but I was like, hey, no, hi, let's talk first. So the patient has this, and she needs to leave in like 10 minutes. She's like, okay, let's go. Yes, good, game plan. We go and sit down. She's like, so what's the problem? I was like, no, I already told you what the problem was. But anyway, the woman didn't care because apparently they're best friends. And then the part that really irked me, after we finished the whole thing, she got her prescription and everything, they start talking about life. Like the doctor sits down, the woman's sitting on the table, and they're like, oh, the husband, yeah, my husband too. Oh, aren't they so annoying? I'm sitting there, I'm like, is this like a girl catch-up? Is this girl time? How's James? Oh, James is good, he's in 12th grade. Did you go to Bianca's birthday party? Oh, the 8-year-old. I thought you had to go to work, woman. I busted my butt trying to like get you to give me all your information with your sass, and then running to find this doctor, telling the whole thing in 1 minute. I literally gave her entire history and everything that she's presenting with in like 15 seconds to the doctor because you made me super stressed, and now you chilled here for another 10 minutes with the doctor just talking about your husbands and how you both hate them and you're just lazy slobs because all men are just stupid apparently. She leaves late to go back to work, but apparently that wasn't a problem, or I don't know, just Miss Lunch Break is apparently on lunch break only for the fact of getting people to rush faster. So yeah, that concludes the 6 kinds of patients I interacted with on my very first day. And then so many things that happened today too, on my second day of family medicine, but I don't know if I should go into all those things because that would be a lot of videos. Thought this was funny, I guess let me know. I don't really care because I have fun making these videos. It's kind of like therapeutic, like get everything off my chest so that tomorrow I can go into work and be like, okay, let's get yelled at today. Mr. Stubborn is back. So anyway, hope you guys have fun. I hope it made you laugh at least a little bit because it makes me laugh. Having a fantastic time on your rotations or whatever you're doing in life. Be safe, be strong, be swag. God bless you, and I'll see you in the next one. Bye. Hi, so how can we help you today, Mr. ED? Hold on, let me do it better because I'm actually more confident when I walk into that room. Now every time I see a woman coming in who's above the age of 50, I just like strap on my cap. Let's do this, boys, because I don't know what I'm in for. It's like a movie. You just don't know what to expect. Except you do know that you're gonna get yelled at. Does it look like Lyme disease? And I was like, no, you know, but who am I? I'm just the 3rd year on the floors. Don't know what I'm doing. Does it look like Lyme disease? Who am I? Just the 3rd year, close the door. I don't even know where I'm going with this.